Good morning, viewers. I am Dr. Damodara Rao, working as a cardiologist in kimsicon Hospital, Visakhapatnam. Today, I am going to talk briefly on congenital heart diseases. The word congenital means born with defect. Congenital heart diseases are present right at the birth. All over the world, nearly 1 to 2 billion people, 1 to 2 million people have a congenital heart disease almost every year. As the technology advances, more and more number of congenital heart people, they are living longer and reaching their adulthood, and they are living a qualitative life and productive life. So what are the types of the congenital heart diseases? The congenital heart diseases are mainly affect the different structures of the heart, which includes valves, and blood vessels. The incidence of the congenital heart disease is increasing day by day, so also the increasing number of the patients reaching the adulthood is also increasing day by day. This is the present problem we are facing in the adult congenital heart diseases. So, what are the types of the congenital heart diseases? Congenital heart diseases, it can involve the valves, either in the form of narrowing of the valves, which we call as stenosis, or leaking of the valves, which we call incompetence or regurgitation. It can involve the valves that separates the right and left heart chambers and upper and lower chambers. If there is a defect in the development, there is a deficiency in the valves and it leads to septal defects. So, if it is in the upper chamber, it is called a atrial septal defect. If it is in the lower chamber, it is called the ventricular septal defect. Coming to the vessel walls, it can involve the vessels. Vessels can be narrowed. As a result, there can be decrease in the blood supply to the structures distal to the narrowed segment. This is seen in patients with coarctation of the aorta, and also sometimes there can be narrowing of the pulmonary artery that leads to pulmonary artery stenosis. It can involve the main artery, or it can involve the branches of the pulmonary artery. Clinically, we divide the congenital hearts into two groups. One is a cyanotic heart diseases and second one is acyanotic heart diseases. Both can lead to decrease in the heart function. The difference between the cyanotic and acyanotic heart diseases, in cyanotic heart diseases, there is decrease in the oxygen saturation in the blood. As a result of decreasing the oxygen saturation, person can have a shortness of breath or syncopals and can have a blue baby. So, this is about the major difference between the cyanotic and acyanotic heart diseases. So, what could be the etiology for this congenital heart diseases? Exact causes are not clearly understood. What is responsible for the decreasing the development of the heart structures, but there are certain suggestions, there are certain causes that are more commonly seen with the congenital heart diseases. One most important thing is genetics. If the person in the family there is a congenital heart disease, likely to have a congenital heart disease in the next generation. So, that is a genetically determined one. Second one is the mother exposes to certain drugs, then can lead to congenital heart diseases in the baby. And the other thing is, if the mother exposes to viral infection, especially measles, German measles, then baby will have a congenital heart diseases, likely to have congenital heart diseases. And third one is, if the mother consumes alcohol or certain illegal drugs, then it can also cause congenital heart diseases. And other important things are exposure to the radiation. These are all the other things. And coming to the what is the symptoms with which the child presents, it varies depending upon the severity of the disease. In the intrauterine itself, sometimes your physician may detect certain slow heart rate in the womb itself. That can be addressed. By depending upon the situation, it can be addressed. So majority of the patients, they develop symptoms soon after childbirth. Common symptoms with which the child shows the symptoms are blue babies. There can be bluish discoloration of the fingers, nails, lips, and that is as in patients with cyanotic congenital heart diseases. Other symptom is shortness of breath. A child can have breathlessness. The respiratory rate can be increased. There can be unusually sweating while the baby is taking breastfeed, or there can be syncopal attack like thing can occur, or there can be low birth weight or poor weight gain. These are all the symptoms of the cyanotic heart diseases or the cyanotic heart diseases. And some of the children, the disease may not be very severe. They manifest symptoms very late in the childhood. Here also the symptoms are mainly breathlessness and fatigue, and sometimes fainting, dizziness. All these things can occur in the late childhood. In some patients, the symptoms may not be present in the childhood at all. They are unnoticed, and they may be present in the adult as symptomatic adults. So in these cases also, shortness of breath is the major complaint, or there can be fatigue, giddiness, fainting. All these things can occur. So what are the treatment modalities? Coming to the treatment modalities, if the patient is in failure, we give certain drugs like digoxin, diuretics. If the patient has got cyanosis, we give drugs that can improve the blood circulation, pulmonary circulation. Second line of treatment is catheter-based procedures. Catheter-based medicines, what we do is we advance the small tubes called catheters right up to the defect and deliver dumbbell-shaped or different dumbbell-shaped discs and thereby close the defects. This is possible with atrial septal defects and certain ventricular septal defects, and also with a patent ductus arteriosus. And third modality is, if it is patient is electrophysiologically abnormal, that means if there is a slow heart rate, very slow heart rate, it can be addressed by putting a pacemaker and increasing the heart rate. Otherwise, if the patient has got a very high heart rate or abnormally very high heart rate, and it can lead to death, in such situations we can put a ICD, implantable defibrillator. So these are the second modalities. And if these two are not possible, third thing is a surgery. Surgeon will open the chest and close the defects where there is a hole that can be patched up, and also he can widen the stenoidal vessels or can put a valves, repair the valves. All these things can be done by surgeons. And last resort is, if all these modalities are not practically feasible, then one has to go for the heart transplantation. So, the child's heart is replaced by a donor of the same size and the donor heart. Coming to the preventive aspect of the congenital heart diseases. As I already told you, there are certain things that are responsible for the development of the congenital heart disease. So, if there is a genetic history, better have a genetical counseling before going for a pregnancy. Second one is, mother should be very cautious and not to expose herself to any drugs or any viral infections. These are the important aspects to prevent the congenital heart diseases. Third thing is, mother should not consume alcohol or illegal drugs. This is also a very important thing to prevent the congenital heart diseases. In adults, the congenital heart diseases may be detected surprisingly as the first detection. Sometimes patient must have undergone a procedure in the childhood that may not be adequate enough in the adulthood. So again, he has to undergo surgery or whatever modality that is practically feasible. So with this, I conclude the congenital heart disease treatment and etiology and how we approach the congenital heart